Welcome to On the Rise by Fresh Business Thinking, a series showcasing entrepreneurs we predict to be the next generation of household names. In this episode, I speak to Jon Bennett, CEO of Ryalto, a mobile app for healthcare professionals.
And we've created something that is super easy to use, that meets the market need, but is also highly secure and robust.
How did you get started?
So Ryalto started 5 years ago. The idea back then was to create a collaboration tool, mostly for nurses, mostly in the NHS. So let's create an app that brings those nurses together, with the idea being that the hospitals could engage with them to book them for flexible shifts. I guess very crudely, you could say a bit like Uber, but for nurses. So the hospitals go to the app and book the nurses that are local to that hospital and bring them in. But it was always planned to be much wider than that, give them other collaboration tools, the messenger system, a news feed. But initially it was all about the shifts.
Right.
And then fast forward, we had a bit of a restart up in December 2019, where we said, actually, we need to push all of the benefits and make sure that the workers and the people that look after those workers know about all the benefits of Ryalto. And that's when the messenger system, the news feed, and the shift booker really started to take off. And the power of all the individual bits started to create something as a whole that was even better than the individual parts.
What are you doing to establish yourself as the go-to messenger service for the NHS?
So before the pandemic, healthcare was moving to instant messengers, moving to the need to be faster to communicate with each other, have something that was a lot more collaborative across different staff groups, across different locations. So the need was recognised and was fulfilled temporarily by WhatsApp. But of course, WhatsApp is not a professional communication tool. It's used across social groups, and mistakes can be made. So yeah, we've probably all done it. We've sent the wrong message to the wrong person in our social lives. That's probably just a quick, whoops, sorry, wrong channel. In the professional world, that could be patient data. It could be something that's confidential. You've hit click, it's gone through into the Facebook ether, because Facebook, of course, owns WhatsApp, and there's very little you can do to retract it. We've seen certain content circulated where in a professional environment where it probably wasn't appropriate. Nothing too illegal or anything, but just something that's not appropriate for the workplace. So that was also a mistake that we saw. And then, of course, people don't realize some of the background settings for WhatsApp. So you can accidentally hook your pictures up to your iCloud, to your other devices. That means that instant picture that you've taken to share with a colleague could actually end up in the cloud or on your other personal devices, which could be seen by others. So the need was generated just by the need within the workforce. And then we've very much taken our messaging system to the NHS and to care, private care, and to social care. And we've said, look, we can see the need. Let's cut through all these risks. Let's take the risks out. Let's ring fence it for professional use. Let's put it on the user's mobile phone still, but let's separate that from what they're doing in their social lives. And Ryalto is secure. You can't add your friends and family to it. Everything that goes on it gets ring fenced within the app itself. And then, of course, for the NHS, we're also on the main framework, which is the Health System Support Framework, which is NHS England owned. We're one of only 40-odd technology companies on there. So we adhere to all of the NHS rules. We've got the best possible app, and WhatsApp already proved that the success for it for us. So we've just slid into that market need in a very approved and safe way.
Yeah, right place, right time. Yeah.
Right place, right time. Yeah.
Why did you feel? I guess you kind of answered this here, but maybe we could go into it a bit more. But why do you feel as though a company like Ryalto was needed?
Yeah. So if we think about the workforce in healthcare, they don't operate like typical workforces do in the UK. So they're never at a computer, or very, very rarely at a computer. They might have to type something up quickly, or they might be asked to do some administrative or HR work at some point, but it's very rarely, and they're often squeezing it in their very precious downtime. They're mobile, so they're either out across a big facility, average NHS hospital, 3,000 odd people. So they're often either across that facility, or they're possibly even moving around facilities. So something like a social care setting or a big ICS or some of the bigger private hospital groups, they're actually moving around locations. And that means as workers, they don't have access to some of the stuff that we enjoy, like collaboration tools, news feeds, places to read up-to-date documentation, places to connect with each other and their employer. So he said, actually, look, everyone's got a mobile device in their pocket these days, and stats around the numbers of people with kind of an iPhone 5 or better, or an Android phone from the last 10 years, the number of people in the UK that now have these is off the charts. So everyone's got this in their pocket. Why don't we take all of that stuff that we enjoy on our laptops and our desktops, put it in the pocket of the user, then they get news, then they get the chance to collaborate, they get the messenger, they get the ability to book shifts. We can give them some wellness support, and we can even pop a little chatbot in there to give them 24-hour support around all things regarding their working life. So the need was there. I think the tech's caught up. And of course, the workforce is very mobile savvy these days. So everything just aligned, which meant it's the right time for Ryalto.
So what would you say your biggest achievement is thus far?
I think we're live across a very major hospital group called Spire. They've done thousands and thousands of Spire Healthcare. They've done thousands and thousands of articles across their newsfeed. I know that through the pandemic, it was highly useful for them to be able to instantly connect with their entire workforce, whether those are the office workers, the people that are typically in sort of office-based roles were suddenly working from home. The healthcare workers were working in a very fast-paced, changing environment. We rolled out there very, very quickly, a lot quicker than we expected to because of the pandemic. And it's now used across the vast majority of Spire Healthcare. There are 39 different facilities across the UK. I know from the leadership team that it's the first thing they check in the morning and the last thing they check at night. So huge success story there. But of course, all the stuff we do in the NHS, we've got other private clients coming on as well, and soon to be working in social care. So I think the good news stories will keep growing and keep rolling.
Why do you think Ryalto has been so successful?
I think there's a couple of things. So we've found the market need. So that need around needing to put a workforce solution in the pocket of every healthcare worker, that's there today. So we're in the right place at the right time, as you said earlier. But of course, it's so easy to knock up a good-looking app these days. You and I could decide to do one and probably have it ready for Monday. That doesn't mean it's the right app for that service. So because we're very robust, we've spent millions of pounds in making the app brilliant to use, but also super secure. And that's why we're on the frameworks. So to get onto these government frameworks is pretty tough. They do a bit more than just kick your tires. You go through weeks and weeks of tests, questions, interviews. And we've created something that is super easy to use, that meets the market need, but is also highly secure and robust. And I think it's very hard to achieve those three things. So if you knock up an app, but it's going to be, it's going to be hackable, it's going to fall over when you start to scale. Ours has got millions of pounds worth of investment into it. It's got thousands and thousands of users now. So it's just in that perfect sweet spot just to keep going and grow across the whole care, not just healthcare, but the whole care sector.
How would you say the pandemic has affected you?
Yeah, I think first thing to say is, we would never have wanted the pandemic. It's been extremely sad. It's caused loss of life and impacted families like we could never have imagined before the pandemic came. So we would do anything for the pandemic not to have happened. But as it has happened, it's sped up the need for our application. As I said, the workforces are more disparate now. Typically healthcare central teams like HR teams, finance teams, support teams are typically office-based together, much easier to collaborate. They're now not anymore. They're working from home, and that the messages we're getting is that's going to be sustained well beyond even when normal returns. It's going to be the new model. So I think it's accelerated the need to have mobile collaboration tools, to have mobile tools that provide the workforce with live news and that help us get these very busy workers into the flexible shifts. There's not enough healthcare workers across the UK or the world, which leaves gaps. And we've now got the process to help make sure those workers get into those gaps and keep giving your family, my family, our friends the care that they need.
How long do you think, if a pandemic never hit, how long do you think Ryalto would, the whole idea of a messenger service for NHS workers, how long do you think that would have taken to kind of materialize?
We were getting there anyway. So this isn't a pandemic-caused solution. It's been accelerated by it. Yeah. So if you think about, I'm sure you use WhatsApp, you probably use FB Messenger. There's probably a couple of other messenger tools you use. So we were already as a society moving into the kind of comfort zone with these messaging apps. Yeah. Of course, none of those are right for professional setting because you can make mistakes and you can accidentally connect with a friend or a family where you're trying to connect with a colleague. So that was already happening. I think what's happened is it's accelerated it. So it's probably brought us forward 12 to even 24 months. Just the rate of uptake has gone through the roof.
So what makes Ryalto unique?
Yeah, so I think there's a couple of key things. So there's a number of apps that do the individual bits that we do. So you could have a messaging app, you could have a shift booking app, you could have a newsfeed app, you could have a wellness app, you could have a helpbot app. You probably see where I'm going here. But what we've done is we've put everything in one place. And that's got three main benefits really. So of course, none of us mind having apps on our phone, but we don't want too many. So the fewer number of apps we can have, total number of apps we can have, the better. So we're giving the workforce just one app instead of multiple apps. But really critically, the power of all of those apps being in one place drives the uptake and the use of each one of those modules. So you might not be into your wellness, but you are using the app to message each other. And when you're in there, oh, actually, I didn't know wellness was for me, but actually some of this content looks like it might be for me. I would never have touched the wellness app, but because I'm here, I will go and check out some wellness content. And actually, I never thought about working flexible shifts because I thought that was really hard and involved loads of paperwork and I had to go and speak to somebody, but there's flexible shifts here, right for me, that meet my profile, and it's available for Saturday night, and I've got nothing on Saturday night, so actually I'll take a couple of flexible shifts. So driving all of that stuff into one place exponentially creates an uptake across the whole suite of products, and that's completely unique. So like I say, other apps out there doing individual parts, but the uniqueness is the fact that we've got one safe, secure, flexible app where everything sits together and drives the use of each individual part.
So this is like the big one. Where do you see Ryalto in the next 5 years?
Yeah, so we've got lots to do in the next 5 years. So we want to have our aim is to have every care worker on the app across the UK, and that's a lot of people, right? So 1.3 million in the NHS alone, 1.5 million in social care. Then you've got all the private hospitals as well. So there's a lot to do, but we want to go international. So we see ourselves in the perfect space to deliver these benefits across geographies. The US is a key territory for us, as is the rest of Europe, the Middle East. What the UK is experiencing from a medical workforce point of view is a global phenomenon. We want to get it right in the UK first. This is where we started, and this is where the mission began. But we're very, very ready this year, if not this year, early part of next year, to go into those other major territories. So 5 years' time, we'll have international healthcare workforces using Ryalto, and probably in a number of different ways that we couldn't have even imagined today. I need to get some necklaces next time.
Some what?
I need to get some necklaces for next time, and then we'll look exactly the same.
I'll send some over.
Yeah, send me one. Yeah, send me a couple.
Get you an earring as well,